Hi, I'm Allie. I'm going to be your student nurse today. Can I get you to tell me your name and date of birth?
Yes, it's Madison Moreland and 11/22/99.
Perfect. I'm just going to give you some privacy real quick. And then I'll wash my hands. So what brings you in today?
I just have this horrible headache that's been going on for a while.
Okay, when did that start?
It started on Friday.
On Friday. And is there a specific place on your head that's been bothering you?
Yeah, it's just the back of my head, like right in here.
The back of your head?
Mm-hmm.
Okay. And has that been going on pretty consistently since Friday?
Yes, it's been pretty much constant.
So for about 2 days?
Mm-hmm.
Okay. And how would you describe the pain?
It's just kind of this like really sharp stabbing pain.
Sharp stabbing pain.
Mm-hmm.
And does anything make it worse or better?
I've taken ibuprofen a couple times and that's helped me.
That's helped, okay. And does it radiate anywhere?
It does kind of radiate down the back of my neck here.
And is it constant? Does it come and go?
It's been really constant.
Okay. And on a scale of 0 to 10, 10 being the worst pain you could feel, how would you rate your pain right now?
I would say it's a 4.
A 4 out of 10? Okay. Well, we're going to move into just a routine assessment today before the doctor comes in to see you. I'm going to start with your vital signs. Get your blood pressure real quick. Just have you stick your arm out. I'm going to do this arm. Perfect, thank you. If I could just get you to hold that with your hand. Set up here. All right, thank you. All right, I got 110/86. Just take that off you real quick. Thank you. I'm gonna go ahead and put this on your finger real quick. Just measure your oxygen. Perfect. I'm gonna take your temperature real quick. All right. 98.9. And then I'm going to go ahead and take your pulse too. I'll do this hand. All right. All right, your pulse was 82 and your respirations were 10. And we are at 98% on room air. All right, I'm gonna go ahead and get started with your physical assessment today. We're gonna start with your thoracic first. Do you have any history of lung disease in your family or on your own?
I don't have any lung history and nothing in my family either.
And do you or any of your family members smoke?
No to both.
Okay. And do you have any history of cardiovascular disease in your family?
My grandpa has AFib.
Your grandpa has AFib, okay. And anything yourself?
No.
Okay. Any shortness of breath or with activity today?
Nothing that I've noticed.
Okay, perfect. So we're gonna go ahead and get started. If you don't mind, I'm gonna palpate your precordium, your chest on the front and back. I'm assessing for any lifts, heaves, or thrills. And on your back, assessing for crepitus, edema, erythema. All right, everything looks good. None of those are present. I'm gonna go ahead and listen to your lung sounds. I'm gonna do 10 spots on front and back, and every time that my stethoscope touches your skin, I'm gonna go ahead and have you take a deep breath in for me, okay? Are you feeling dizzy or out of breath at all before we get started?
Oh, no.
Okay, perfect. All right. Deep breath in. Are you still feeling good? We're good to go?
Yep.
Okay, I'm gonna do the same thing on the back. Big breath in. Perfect. Your lungs sound healthy. There was no wheezes, crackles, or rails. I'm going to go ahead and do your heart assessment now. I'm going to listen to 5 spots on the front of your chest and then as well as your carotid arteries. I'm going to start with your heart sounds. You don't need to worry about holding your breath or anything like that. All right. All right, I'm going to go ahead and have you hold your breath while I listen to your arteries. Perfect. And I'm going to switch to the bell and go over the same spots, okay?
Okay.
All right, go ahead and breathe normally for this one. All right, if you want to go ahead and hold your breath for me. Perfect, thank you. There's no bruise present, and your heart sounds are normal, no extra heart sounds or murmurs. So we're gonna go ahead and move on to your head assessment. Have you had any changes in vision, smell, taste, or hearing lately?
I have noticed that with the headache, it makes my vision kind of blurry sometimes.
In both eyes?
In both eyes.
In
yeah.
both eyes, perfect. Do you wear any hearing aids or glasses?
I wear reading glasses.
And no hearing aids? Okay. All right, so if you don't mind, I'm gonna take a look at your hair real quick.
Okay.
Looking for lice, any signs of parasites, which there are none. Your hair distribution is even and pattern is normal, no baldness. I'm assessing your facial features. Everything looks symmetrical. Your facial expressions match your current state of emotion. I'm assessing your eyes. I don't see any swelling or drainage. Your sclera are white. Your eyelids are not drooping. I'm going to go ahead and test your hearing and look in your ears real quick. Can you hear that?
Mm-hmm.
Perfect. And on this side?
Yes.
Perfect. Thank you. Go ahead and take a look in there. Looking for any excess cerumen, foreign objects, or otitis, and everything looks good on this side. Do the same on the other side. Everything looks good there. Go ahead and feel your auricular nodes. Perfect. All right, I'm gonna go ahead and do some eye tests on you. I'm gonna shine a light in your eye. Do one side and then the other. All right, I'm gonna go ahead and just have you look straight at that door. All right, then one more time. Thank you. And then one more. Perfect. Then I'm gonna have you look at my pen and without moving, follow it, okay? All right, pupils are equal, round, reactive to light, and accommodation. I'm gonna go ahead and palpate your nose here for patency. And if you don't mind if I take a look.
Yeah, of course.
All right, I'm gonna have you tilt your head up for me. I am looking at your nasal mucosa, making sure it's not inflamed, everything looks healthy. And if you don't mind saying a big ah for me. I'm assessing your salivary glands, your palate, tongue, everything looks healthy. Your dentition looks good and your gums look normal, and I'm gonna stage your tonsils as a 1, no swelling is present. Thank you. All right, we're gonna go ahead and move on to your skin assessment. Have you had any changes in your skin, itching, rashes, lesions of any kind?
Nothing that I've noticed.
Nothing that you've noticed, good to hear, okay. I'm gonna go ahead and palpate for skin temperature. Skin is warm and dry, no diaphoresis is present. I'm not noticing any erythema, no skin lesions present. I'm gonna go ahead and palpate your lymph nodes up here, posterior and above your collarbone. Those are normal and present. Can I go ahead and get you to swallow for me? All right, swallowing feels good. Your thyroid is not swollen. There's no goiter present, and there's no tracheal deviation. Do you mind if I take a look at your hands real quick?
Of course.
Thank you. Capillary refill is less than 1 second, which is healthy. Your skin sugar is normal. You're hydrated. I'm not noticing any clubbing of your fingers. If you had an IV site, I would assess for drainage, erythema, and swelling, but you have no IV site present. I'm gonna go ahead and do a Braden scale assessment on you. You are an active young person, so you're good on activity, your mobility is good, your nutritional intake is healthy, no excessive moisture on your skin, and no friction and shear wrist, so I'm going to give you a score of 23. And would you mind standing up for me real quick?
Yes.
Perfect. I'm gonna have you take 3 steps that way and then 3 steps back to your chair. You can go ahead and sit down. I am assessing for posture, normal gait, and motor activity. Your posture looks good. You look like your level of consciousness is healthy. You're able to answer all my questions and hold conversation well. I'm gonna say that you are alert, awake, and oriented ×3. Your dress and groom is healthy. You're dressed appropriately for the weather. No odors, smells. Your teeth are healthy. Your hair is clean. Your hygiene looks really good. Your skin color matches your racial heritage, and your facial expressions are symmetrical. I am going to go ahead and let the doctor know that you are ready to be seen, and he'll come in here and check on you, okay? Just wash my hands real quick before I leave.